Good evening. I'm John Batchelor, johnbatchelorShow.com. Swine flu, H1N1, dominate the story right now. The United States, Mexico, Canada, the globe. The WHO moves. The CDC moves. The DHS moves. I go immediately to Dr. Henry Miller of the Hoover Institution, who for 5, 6, 7 years has instructed this audience about the threat of what is happening right now in swine flu. Henry, good evening to you.
Good evening, John. Good to be with you.
Henry, we've rehearsed for this. We thought it was going to be H5N1, the avian flu. However, this is related because my reading is that somewhere inside a pig, somewhere in Mexico, a combination of viruses produced H1N1 in a way that it can transmit human to human. Let's start with why the pig. Why is that important, Henry?
Well, the pig is unique in a couple of ways, John. A couple of ways that are worrisome. One is that it can be infected by not only the group of viruses, of flu viruses that normally infect pigs, but it's also susceptible to infection by the flu viruses that normally would infect humans and the group that normally would infect birds. And this has a couple of implications. One is that when you passage a bird virus through any mammal that to which the mammal is susceptible, the virus becomes more efficient. It adapts, and it becomes more efficient at being transmitted to other mammals, such as humans. So that's one factor. But the other more important factor is that the pig, because of its susceptibility to these many groups of viruses, if it's infected simultaneously by more than one kind, they can carry out a kind of genetic reassortment where their equivalent of chromosomes are exchanged and shuffled, and you get something that's really quite fundamentally new. And this can lead to a profound change in the virus called an antigenic shift, which leads to a new virus to which no one has immunity, and therefore which can spread very, very rapidly and cause a worldwide pandemic. We've seen that previously. We've seen that in the influenza pandemics of 1957 and 1968, where these kinds of antigenic shifts caused a new virus to which no one had immunity and which caused worldwide pandemic.
I'm speaking to Dr. Henry Miller of the Hoover Institution, and Henry is designing a scenario that looks like now it is still anecdotal. We do not have all the facts. I remind everyone, in a war, the first 3 reports are wrong. Be very careful about coming to conclusions with the evidence that we're getting now. We do see sometime in the last 60 days an unusual spike of flu cases in the Mexico City area, and some of those flu cases led to deaths, especially between the ages of 20 and 40, which is highly unusual in any flu season. Those deaths are related in some fashion to this swine flu. That's what we're calling it. Henry, we now have reporting from Mexico to California to Texas to Canada, both sides of the Canadian country. We also have reports, possibly in New Zealand, a returning airplane. We're getting a lot of anecdotal reports. Do you expect these reports to multiply over the next few days, and that we cannot know about the spread for some weeks?
I think these are certainly going to multiply. What we've been seeing is that there are connections in almost all cases, indirect or direct, to travel to Mexico. Right. So in the Canadian cases, for example, the 4 cases in Nova Scotia, these were people whose contacts, household contacts or school contacts, had traveled to Mexico recently, and so they appear to have contracted it from them. In the British Columbia cases, 4,000 miles away on the other side of Canada, the 2 persons who were infected had actually traveled to Mexico. And there are similar connections in most of the other cases, such as those probable cases in New York City, Queens prep school, that where some of the kids had traveled to Mexico recently and returned and apparently infected some of their classmates. So these new emerging diseases spread and travel very, very quickly. We saw that with SARS in 2003, where within a few weeks, a new virus that emerged in southern China spread to 37 countries.
Henry, you've warned that the reason we watch Southeast Asia all these years for avian flu is because people live in close proximity to their livestock, to pigs, and that increased the likelihood of it jumping from a pig or a bird to a human. In this instance, the anecdotes indicate that this is being spread human to human. Is that correct? And that makes it much more dangerous than animal to human.
It makes it much more dangerous. Our fears about H5N1 were that the virus would eventually mutate or shift to rapid, efficient human-to-human transmission. That has not happened yet with H5N1, but this virus appears to be adapted to human-to-human transmission. One thing we don't have a good handle on yet is how virulent, how dangerous the illness is or is likely to be. The mortality rate in the Mexican cases, of which there are more than 1,300 reports of infections, is about 7%. And that's somewhat similar to SARS in 2003, although I emphasize that SARS is a totally, completely different kind of virus.
And avian flu can be as much as 100% in the first 48 hours, so this is considerably smaller scale threat than an avian flu epidemic would be.
Right. What we've seen with H5N1 over the past 8 or 10 years is that the mortality rate there is something like 60%.
Right.
And that compares to the regular seasonal flu, where mortality is under 1%.
Is it significant, Henry, that there were deaths between the ages of 20 and 40 in this particular outbreak?
It is conceivable. We've seen that with past pandemic strains for reasons that are not clear, but it may be simply that there's a more aggressive, profuse immune response from young, healthy people, and that it's the outpouring of fluids into their lungs as part of the immune response that causes the morbidity and death.
All right, prognosis, Dr. Miller. I'm told that we do have antiviral drugs. Are they good for this, even though it's a new kind of virus?
We know that two of the older ones, which have been around for decades, two of the older drugs are not useful, at least on the Mexican strains. The virus appears to be resistant. The newer drugs, namely Tamiflu and Relenza, we believe will work, and that'll be a major line of defense as we begin to mobilize and try to stop the spread.
We see the CDC briefing hourly now. We don't have any travel advisories yet. Do you expect that? We know that the schools are closed in Mexico. We know that the people are off the streets in Mexico City. Does that look like a scenario for Southern California?
Well, I think if it's not official, it should certainly be unofficial. It's commonsensical that if you don't absolutely need to, you don't go into a region where there are not good health facilities, there's not good public health protection, there's not good public health infrastructure, and where there's an emerging disease that's flaring up.
Henry, is it enough to wear a mask and wash your hands? Is that a good enough defense?
No, there is more that people can do easily. Avoid people who are sick.
Right.
Stay home if you yourself are sick with flu-like symptoms. And swine flu symptoms are very similar to those of ordinary seasonal flu. Headache, fever, cough, muscle aches, and so on. So, but wearing a mask, washing your hands frequently, avoiding touching your hands to your eyes and nose and mouth are all good ways to prevent infection.
Dr. Henry Miller of the Hoover Institution, it is early. We're told from Mexico City that it wasn't until late Thursday, the 23rd, that the Mexican health officials got confirmation from a CDC lab and a Canadian lab that this is a new virus, an H1N1, with no obvious treatment until we find that Tamiflu and Relenza do work. It's early yet. Early. I'm John Batchelor, johnbatchelorShow.com.